There is one more week remaining at the State House as the General Assembly works to make this short session shorter by 7 days. And with 8 weeks in, Indiana senators gave final approval Thursday for a literacy overhaul bill that will require reading deficient third graders to be held back a year in school. Thursday also saw the Senate Appropriations Committee remove a House bill providing 13th checks for pension fund bonuses and replace it with a Senate bill introducing a future hybrid approach. House Republicans on Tuesday amended their Senate counterparts' latest attempt to limit the governor's emergency powers by making statewide disaster emergency declarations lasting 30 days with one 30-day renewal. As this legislation advances, one Northeast Indiana legislator said he wants to be sure that the state is prepared for future disasters. And that lawmaker is also House Assistant Majority Floor Leader, and he is with us in studio today. And he joins our second guest, who is involved in her first General Assembly session and her first visit here with us on Primetime. Good evening, I'm Bruce Haines, and so let's name names. With us, 31st District Republican State Representative Lori Goss-Reaves and 51st District Republican State Representative and Assistant Majority Floor Leader Denny Zent. And all of us here invite you to join us in the conversation. You can call with your questions and comments by using the number you see on the screen. As we widen out, and here we are. We have Representative Goss-Reaves, Representative Zent, Lori, Denny, thank you both for being here.
Thank you for having us.
Appreciate it. Very,
it's a pleasure. I enjoy it.
Very, very much. And for Lori in particularly, your first time with us, yes. People are perhaps thinking District 31. I should know where that is. Yeah. So fill in those edges for us here. Yeah. Tell us a little about Lori and about the folks you represent.
Okay, I serve all of Grant County with the exception of a chunk that has Swayze, Indiana in it, and I serve a portion of Madison County. So Indiana Wesleyan University and Taylor University are both in my district.
And Indiana Wesleyan is a familiar place. That's a place of employment, I believe, when you're not representing folks down at the State House.
That is correct. I'm a college professor, social work professor, and I also taught at Taylor University in the past. So I really am thankful to represent both of those universities and all of the people of District 31.
And joining the legislature following the fall of last year, I believe. And you're sitting next to a gentleman who has been moving through about his 12th or so year in the legislature. And Dr. Zent, sir, your district that you're representing, you're very compatible in terms of distance, only we're going north from Fort Wayne on 69 for a while.
Yeah, that's true. It's all of LaGrange County and most of Steuben County. And what's unique up there is we're kind of the outline of the district is Michigan or Ohio or both. And there's plenty of lakes up there. And that's what drew us back after time in the military. And we live on Lake James, and it's a wonderful area. And I've been fortunate. People have kind of supported me for 12 years, but as everybody knows, it's probably time to move on to another phase of my life, and I'm looking forward to that.
And in fact, let's linger there for a moment. I was hoping we would get to it eventually, but now is perfectly fine. But in looking at those past 12 years with at least one legislative session per calendar, you've seen them all. How does the one we're currently in compare to the ones that you've also noted in your logbook?
This is not a fiscal year, so it's supposedly shorter. We're supposed to be done in the odd-numbered years by midnight on April 29th, and by midnight March the 14th, basically the 15th, on the short terms, but we don't deal with fiscal matters. And quite truthfully, some of the other short sessions seem to last as long as the long ones, but this one, it may just be that I can see the finish line, and it just didn't, beat me down as much, I suppose. Mm-hmm. It is very grueling, and people think that you just go down there for whatever reason. If you're involved and you want to represent your district, it is 24 hours a day, and when you're not down there, it's still very grueling. And I'm going to take the opportunity to say that you wonder what will happen if you leave. You know, everybody thinks you're irreplaceable. Someone sitting right here is going to be a terrific legislator. This is actually her first year, and I can tell you that you sit back, you learn more by listening than you do talking, and then when they get in your lane, your area expertise, and Laura, you do have an area of expertise, you can just see that start to grow. So we're fortunate. There are people that are going to be there representing us in northern half of the state that really are going to do a good job, and we should be grateful.
Yeah. And I'm wondering, with the kind of encouragement from the gentleman to your right, in addition to that, what have you been coached about regarding going into your first session? How do you prepare for something like this?
I just believe life's about relationships. And so my goal was to go down there and build relationships and listen and learn. And Dr. Zent has been a wonderful mentor to me. Several people, truthfully, have been very encouraging, taking me under their wing. Mike Karakoff, who represents the other portion of District 31, reached out to me as soon as I was elected. And he was someone I could contact really from all summer long as I was trying to develop 5 bills and listen to my constituents as to what those needs in our district are, and being able to then bring those as authored legislation into this session was really what I got busy on right away. But there's been a few opportunities where I've been asked to speak, and I've appreciated those times, but I also believe it's really important to be careful and to listen more and to try to earn the respect of the people that are serving with me. But what I have really done this time is developed a lot of respect for them. There are some incredible people at that State House, and it's just been so nice to get to know them.
What were some of the aspirations you carried legislatively with you into the early weeks of this one?
So I authored 5 bills, but they all came from my constituents, right? So 5 is our maximum. So one of them, House Bill 1138, I actually was able to sign that yesterday. It passed the House unanimously, then went over to the Senate and passed unanimously, came back with an amendment, and so that was concurred. And so it is now going to go to the governor's desk. So I'm very happy about that. The second one that may make it across the finish line, we shall see, is House Bill 1418. That came from a detective in my district who wants to see babies be born healthy. So in 2012, I was asked to serve on the Maternal Substance Abuse Task Force at what was then called Marion General Hospital. And there I learned about neonatal abstinence syndrome and what happens to our babies when they're born addicted. And so House Bill 1418 is an attempt to get moms who are using substances that have been charged with a drug crime into a diversion program or a drug court at initial hearing in hopes that those babies can be born healthy. I care a lot about education. I care a lot about our kids not going to school with additional challenges, and I think this will help with that. So I concurred on it today, so we will see if it can come back and pass through the House. Another one was on age verification, and that bill actually was authored by a senator, and so it was also approved by the House, passed the House, I guess is the right way to say it, and so I was able to be a part of that bill. Fourth one was about continuances in child welfare. My bill did not get a hearing, but Representative in the House had one that was really better than mine, and so it passed the House. It's now in the Senate, so I was able to co-author that. One that didn't get a hearing, which is totally fine, was about human trafficking and trying to get those individuals counseling through the CHIN system without them having to testify against their offender. And then the fifth one, I'm going to have to think a minute on the fifth one, but I'll think and come back to me on that.
Okay.
It got adopted into another bill, but I can't. Not my language. It didn't get a hearing, right. But it did get through a different way. So.
Yeah. So in talking to your colleague then, with some of your legislative options for your final session, what made that list?
I generally concentrate on veterans issues because I've been there, done that, and on healthcare issues, and specifically as a retired dentist and endodontist, I've got some background in that area. So one of them was a compact bill. That means that it makes it simpler for dentists and healthcare providers and hygienists from other states to get licensed in our state. I mean, you pretty much have to pass the same national exams and the accredited dental schools. So Indiana ranks 46th out of 50 states with the number of dentists per 100,000. That hurts the delivery system. And part of the reason is up here we're growing when the surrounding states aren't. We're attracting people here, but we also have to stay up with our professionals. And that was one of the bills we had in the compact. If we can get that through, it basically allows us to be one of the initial 7 states that'll pretty much set up the parameters for years to come. And it's always nice to be at the head of the table. So that's one of the things that we're working on, but it had a small fiscal, and this isn't the fiscal year, so we'll see how that goes. Another one I was very interested in, because my father suffered a stroke, was a stroke bill where we're going to do a study and find out the best way to handle it in a lot of rural areas. EMS goes out and they encounter somebody with a stroke. There may be 2 hospitals both equidistant away, but one of them's better situated, better equipped to handle strokes than the other. You don't want to be twice as far away when you figure that out. A lot of study needs to go into that, and a lot of the areas might, upgrade when that's made known. That's something that had a large fiscal, so it'll be a study committee, and it'll probably come back in full force next year, and I think it'll get a lot of support. Another bill was what COVID taught us a lot of lessons, and in hindsight, we need to utilize all the professions in healthcare. When COVID first hit, they shut down the dental offices for 2 months. I mean to tell you, because I experienced when we had another epidemic called AIDS, they didn't know how it was transmitted, anything except for it was totally fatal if you contracted it. Dentistry did a lot with personal protection equipment. We were on the forefront. Guess where COVID originates? Oral pharyngeal area. Everybody felt, everybody in the emergency room is going to be contaminated. Dental office was right up front, but we knew how to handle that. So they finally kind of figured that one out and opened dental offices up. You can only go so long without being seen. And now we're trying to utilize the healthcare knowledge of the dental team, the hygienist, the dentist, if we get an emergency in the future. Also, vaccines. I don't know of anybody that ever gave more injections than I did. I don't care who they are, because every procedure typically required that. So I think what's happened, and we've had a very good experience. Now we have a couple of physicians in the House, and we have one in the Senate. That has dramatically improved. In my 12 years down there, the knowledge base that we have is just inspiring. And I think we need to have more folks that give up to go down there, because what their knowledge is. I said stay in your lane earlier. Terminology now would probably be your bandwidth, but we do have a lot of well-informed, educated people in the State House. We bicker a little bit, but typically we come up with the right answer, and if not, the next year we'll go back and get it right.
Well, I'm thinking as you're sharing about the makeup of a lot of the legislative committees on House and Senate side, and serendipity being what it is, both of you serve on public health in the House among your other committee work, and that had to be helpful to see Representative Zent in the same space.
Yes.
But talk about the dynamic of public health, because this is one of those committees that receives not only bills with which may be related to your authorship, but it may well be too that others are passing through. So you're seeing a pretty broad swath of proposals. What was the Public Health Committee experience like so far?
Yeah, I'm really thankful to be able to serve on that committee. I'm a licensed clinical social worker, served for over 30 years as a mental health counselor, as that licensed clinical social worker. And so the mental health bills come through that committee. And so that has been really nice for me to be able to be on that committee. I also serve on insurance, and there is there's some overlap in understanding, how those two things work together. And then my other committee is the Child and Family Services Committee. But serving with Dr. Zent on public health, it's really how I think we really got to know each other, because I looked to him and asked a question, and he was so kind with his response. And so I have so much respect for Dr. Zent. What an honor to be here with him tonight.
I can reciprocate, because all I can tell you was when I first got on public health, the bandwidth wasn't quite what I would hoped it would be, and we now have so many talented people in there. And healthcare is not just hospital driven. You have dentistry, you have optometry, you have mental health, and they're all huge. And I think the funding formats and everything else is taking that into consideration, because if we don't have that available for our citizens, we've got other issues. And I think most of the research and the statistics and everything that come out have verified that. So the bandwidth of what we're handling in the health committee has expanded in my time there, and that's why we're fortunate that we have some people that can fill in. Because I will tell you that the experts and the people that give you opinions from the hallway, and a lot of times I was Air Force too, is like 30,000 foot level. And you get people that are right there doing that treatment, that's like right on the ground. And we rely on those people because they're in the committee. We can talk to them all the time. And as I said, I think that the bandwidth of everybody in the legislature it's just grown with the talented people that I have seen come in the last 10 years.
Well, certainly this session included significant legislation. They're all certainly relevant in their scope. But this week we had moving through Senator Brown's bill to reform health care. That's heading to the governor's desk. This is the one about increasing access care for Hoosiers Everywhere 2.0. And Denny, you were a sponsor of the Senate bill on the House side. Talk about, if you will, how we move from 1.0 to 2.0. Some of the things that you found worthy of support in the bill.
Well, the bill had a number of issues in it, and one of them was to streamline, facilitate nurses getting licensure. And we have found, and I know personally even before this bill came up, that the Philippines has a very good system, and Philippine nurses coming over here and from other countries, if they're qualified. We lost a lot of, not just nurses, I know in dentistry, we lost a lot of hygienists that were senior, and when the scare came up about COVID and nobody knew the answers, they said, I don't need to deal with this, and they retired. And good for them, but it's difficult when you don't project those retirements. There is, as I said, there was other aspects to that bill that as far as streamlining the reimbursement rates for different provider organizations, which is always good. But I hung my hat on one big issue, and it had to do with dentistry. And I don't believe we can solve all of the costs and all the discussion you've heard about how we're providing care, but we can't contain the cost, unless we have a robust discussion between not just the providers and the insurance companies, but also the patients. And everybody's got to be considered, because it's almost like they always used to use silos, but it's monolithic here, maybe the big hospital networks, providers, and on this side, the insurance company, and you as a patient, it's that little speck on the ground. You don't think you have any input. And what I tried to do on the dental aspect of that bill was the insurer is obligated to send the payment to where their client, the patient, says to send that. It had been used by one insurance company to kind of get in between the doctor and the patient, and that's a no-no in my world. So now you got right to the bones of it, and I brought that up. Senate Bill 132, passed the House 94-0, passed Senate 45-0, and I'm happy.
It's on its way. Among the bills that are finding their way is one that comes to conference committee. Both of you are co-authors on the House side of it, and that's about the pension plan, the funding. I just wanted to touch on this one because you both share this dynamic, but we have a House version where Senate Bill 275 came over to the House and was stayed in committee when House Bill 1004 on the 13th check went over to the Senate. The Senate language went back into the House bill, and it looks like it's on its way to move forward. As viewers watch tonight and have questions, and they are public employees and are wondering about all of this, what's your sense of comfort or counsel for persons wondering, will my check come in, or is there something better worth waiting for, perhaps is the way to frame it. Lori?
Dr. Zent?
This has been annual, or at least during budget years that this come up, and this is a non-budget year. But actuarially, you look at something like that, and the 13th check is something you get right now. If they actually try to increase the reimbursement and do away with 13th check and maybe accelerate their actuarial numbers, ultimately, I think a lot of people would be better off if they do the Senate plan, but a lot of times people count on that check now. So that's very difficult in the transition. And I was kind of hoping that maybe we'd have the options, you can opt to take this or that, but ultimately, you got to stay with one or the other. So it's all, the House typically goes with the 13th check, the Senate, even though that House is supposed to take care of finances, figure out how that works. They come up with their plan, and it's one of the things that goes down to the wire almost every year.
Yeah. It seems that some are going through, so it always then leads to the question, guidance from some of House and Senate leadership suggesting that the session could end on March 8. You're able to be in session through March 14. So why a short session necessarily, from your perspective?
Well, it saves the taxpayers money because when we're not down there, whether it's per diem or mileage or anything else it saves. Typically, we work till Thursday evening and take Friday off and could come back Monday and have to be done by Thursday. But if we can compress that a little bit and stay Friday and maybe Saturday and wrap it up, it's better for everybody involved. And also understand that these legislators have a different job for the most part, because it's listed as, well, in my world, it was the most intense part-time job I've ever had in my life. I envisioned part-time job as like when I worked with J.C. Penney when I was in high school in the 60s. That'd be the 1960s. And I can tell you that this job is intense, and I think that if we can wrap it up early, it's better for everybody. Because at this point, you're going to haggle over the same things. If you put a deadline and a shot clock in there, they're going to have to come to the table and we're going to get stuff done. Otherwise, they'd extend it 4 more days.
Well, in the discussion of time, we are already under a 2-minute warning, but I do want to ask you, with Lori present, as guidance from someone who has indeed 12 years of legislative experience and far more in public service, and including your profession as well, what are some of the takeaways for you, and that these might be wishes for all who step forward and seek to serve?
I can tell you that you learn more by listening. And a lot of people say, why don't you say anything? And I was sitting there and I'm thinking, I know what I'm going to say when you get to an area and I'm an expert, but you can pick up things. As Lori has mentioned, there's people that in certain areas, they are experts. Go to them, find out. You don't have to hash it out on the floor. There are some lobbyists that are very, very astute. Get good questions and have them answer just your point of view and find out, because otherwise they might give you a roundabout answer. It's been very informative, and she's got the background where she'll be able to pick it up very quickly.
I hear of folks suggesting that the short session is a build-up for activity to come in the longer session a year out. What is your sense of your takeaway from your first session so far?
It has really just been eye-opening to see how much people truly care. We are almost out of time, but we have had a lot of people come to the State House, right? Individuals who have children with severe disabilities. I have a son who has Down syndrome and autism. And so being able to engage with those people, being able to take their phone calls, being able to listen to them, to hear their stories, and then to try to help them be their child's voice in a way that can be fiscally responsible and also meet the needs of our Hoosiers. That's been my takeaway, and it is really, it's just been something that I think God has prepared me for, and I'm just so thankful. And I want to say, I did end up talking about all five. As I did the math here, as I was listening to Dr. Zent, I did talk about all five bills. So thank you for letting me have the opportunity to do that.
Well, we look forward to having the opportunity of welcoming you back as this short session goes along in the year. And Representative Zent, sir, thank you for your continued service. Best wishes as this one wraps up and the next chapters start to be written.
And thank you for your continued interest in the program. It's terrific.
Our pleasure. Thank you for watching as well. For all of us with Primetime, I'm Bruce Haines. Take care. We'll see you again next week. Good night. The preceding program on PBS Fort Wayne was made possible in part by
Businesses constantly evolve. The Rogers Company started as Rogers Markets in 1944. Today, the Rogers Company is commercial property and real estate development and a proud supporter of PBS Fort Wayne. The Regional Chamber of Northeast Indiana advocates for world-class infrastructure, a competitive business climate, 21st century talent, and rural investment. One region, one voice. NEINadvocates.com.